The Green River District Health Department did a community health assessment throughout all 7 counties of our district. It was a big undertaking for us and something that we really had to convince our partners would be a positive for our communities, and it really has been, because what came out of that are every community chose 3 top priorities to work on in their community, obesity being one of those priorities. And actually obesity came out as #1 in all 7 counties across the board. So the border of the county didn't make a difference because that was a consistent message all across all 7 counties. And so what has occurred from that time is that there have been work groups that have been established in the different counties, and they've chosen different tactics and different initiatives to work on. And we're really seeing a positive impact in all of our communities on the obesity issue. From the parks to the food and nutrition initiatives, and just that general awareness that our communities are learning about what needs to be done and really trying to make a difference in our, not just our children, but the families and the community as a whole.
Hi, I'm Carrie Bodenheimer, Recreation Superintendent for the City of Owensboro. I've been involved with the Healthy Horizons Task Force for many years now, and thrilled to be a part of how we move towards making Owensboro the healthiest community in Kentucky, specifically with how we fight obesity and within childhood obesity. We are very blessed here in Owensboro to have what I think is one of the best park systems, certainly in the state, if not nationwide. We have over 900 acres within our city limits, some of it passive, some of it active. That includes over 30 miles worth of trails for hiking, walking, and biking. And many facilities such as swimming pools, ice arenas, football complexes, baseball and softball, you name it, I think we have it. From the park standpoint, of course, with our parks and our 30 miles of walking trails, anybody is able to come out at no cost and get, activity, whether they want to run the park or walk the park, put the kids in the stroller, come out for the day. Of course, we're here to promote healthy activities for our youth and our families, and again, at a very economical, if no cost.
We'd like to tell you a little bit about what we do in our school district that is making things healthier for our community in Owensboro and Daviess County.
Some of the things that we're doing in the Owensboro Public Schools is we're looking at what we're currently serving on our menus. We're offering more fresh fruits and vegetables, and we're offering a variety of things, not just the canned product, but trying to incorporate items that are in season, such as watermelon, cantaloupe, the fresh fruits that we can purchase from the local farmers, and then during the winter, things that we can purchase that are at a reasonable cost from other dealers.
Absolutely. And we even have some local farmers who do hydroponic vegetables for us as well. And the high tunnel vegetables, which gets us in different seasons too, because some of our growing seasons are in the summertime. And that leads us to summer feeding. We both have really strong summer feeding programs. We serve about 70 some odd sites between us.
Yes.
And feed about 4,000 meals a day.
Our whole goal is to feed kids and provide nutritional meals to the students.
It's very exciting to see so much collaborative work taking place in our community. For a long time we've known that teaching people to have healthy habits is not always easy. Most people know they're not supposed to smoke, they're not supposed to eat unhealthy, but sometimes really getting to them and making those habits stick is what it's all about. And a lot of groups in this community are really coming together to make those things happen. One thing we've done as an organization is work collaboratively with the Chamber of Commerce and some other entities to do a Get Moving Challenge. We've actually done that for the last 5 years. And that's all about teaching people to incorporate 30 minutes of exercise into their daily lives. And while that sounds hard for some, once you get folks working together, they really find that it's not that hard at all. Again, with our community, there's so many other things through Healthy Horizons and the other groups that are bringing people to the table to really see what each person can do to make a difference. And that's what's really going to be sustaining in our community and really, truly turn the dial to make health improvement efforts for our citizens in our area.
Our goal and objective, what we've been working on over the past 2 to 3 years, has been getting fresh local produce in more hands, more houses in this community.
And we've done that by expanding the Owensboro Regional Farmers Market to multiple remote locations around town to provide convenience. We also provide with Cecil Farms a CSA where we deliver fruits and vegetables directly to the doorsteps and homes of these busy working families. And both objectives, both projects have gone over.
We're here to talk today about the Better Bites program that we are implementing in Daviess County, Kentucky. This program came about from a training that I attended with some coworkers at a Growing Healthy Kids Kentucky training. Better Bites is a program that you can implement in the county to increase access to nutritious foods as far as concession stands, school, after-school programs, anywhere that kids and families come together in the community.
Well, we're excited about this opportunity to partner with a variety of different organizations in our community. And one of our areas of focus at the YMCA is healthy living. And the Better Bites program fits right in line with that. And we feel like providing healthier choices to the children that come in every day of the week is going to help improve the health of our community and help improve the health of our children. Not only will the children of the YMCA benefit from this program, but the adults will too.
Our board approved as a district that we would be a healthy school district in partnership with the Alliance for the Healthier Generation and Healthy Schools, and really looking forward to moving into the next school year and the things that they are planning on doing within their individual schools, all around healthy foods, healthy students, healthy staff, monitoring our vending products, what's served in our school, all with the idea of helping and trying to impact student health today so that hopefully will impact adults and choices that are made tomorrow into the future.
River Park Center found a way that they could be a community partner as the community looked to address obesity and nutrition. River Park Center was able to add more healthy choices to our concession stands. We also have more than 100 volunteers who help us during performances, and we gave them healthier options for snacks while they're here at River Park Center. And we saw a great impact on how the community was selecting the foods and beverages that we offered through concessions. Before, they might have been eating chips and candy and crackers, and now they were choosing things like low-fat yogurt or string cheese or fresh fruits and vegetables. So River Park Center felt that we really did address the nutrition needs of the community and just offer healthier choices for people while they were here at River Park Center.
And today we're at Yellow Creek Park to be able to discuss the walkability of Daviess County. While we're very proud of our small trails, it's our goal throughout the course of the next several decades to be able to connect Owensboro to the state using trails and other corridors that would go from here through the state parks and to be able to eventually connect down to Mammoth Cave National Park.
The next steps for us is that every 3 years we'll be looking at doing another community health assessment. And so we have been trying to measure every year the community health improvement plan, what's happening with obesity and the other initiatives throughout our communities. So in 2015, we'll be starting that process all over again, measuring what impact we've made, what changes we need to do in our communities to continue that impact, and gathering those partners together to see how we can effectively work together to make a difference in our communities.